A little more far removed topic in terms of talking about headaches would be trying to look at the mobility and or potential tightness of your latissimus dorsi muscle. So your latissimus dorsi or your lats, which people will think of like a lat pull down, or if you're doing pull ups to a pull up bar, you're really using a lot of your big lat musculature. Your lats start at the base of your low back, and they are big and broad and come up through your rib cage, travel underneath your armpit to the front of your shoulder. So if you can picture that line of tissue traveling through here, if it's tight, it actually can really promote some of that slumped posturing. So let's say you've been doing pec stretching for years and you've been doing a lot of neck stretching or neck strengthening and you've not really quite had much improvement, or you feel like you're still kind of fighting that losing battle in terms of trying to sit up tall and maintain your posture, there's a potential that the lats could also be an option as to maybe why you can't do that. Is that tightness from that muscle pulling you down because it's such a large muscle and it's also a large stabilizer for our trunk, that potentially could be why you're not able to fully find that upright posturing. So a nice way to incorporate stretching for that area would be to sit in, you could sit off the edge of a table, but I have the flexibility to be able to sit in a crisscross position or like a butterfly position. So I prefer to sit like this because I personally am a little bit more flexible. So I will sit like this to lock my pelvis into place. So I talked about how that muscle does start all the way down at our the top of our tailbone. So we want to make sure that our pelvis can stay locked out because we want to lock the one edge of the muscle into place before we start to stretch it into the opposite direction. So again, when we picture that muscle coming up and across, it attaches through our rib cage and through the front of the shoulder. So I'm going to take one hand just to brace my side here, and I'm going to take my other hand and just reach up over the top. And again, I have a little bit more flexibility, so I'm going to drop my elbow down, and now through here we're seeing that large opening through the right side of my trunk. And if I take my hand and open it up and close it, I can feel a change in the stretch. So I'm going to find the place where I feel the largest stretch but still comfortable. And now once you've found that position, you want to really make sure you're incorporating some nice breathing. And when I say breathing, I want you to think of rib cage breathing instead of belly breathing or taking a really big breath. So we want to think of those lower rib cages, or the lower rib cage. We really want to think of expansion through that area. So you're going to think of trying to take this bottom portion of your ribs and you're going to expand it up towards the ceiling when you're in that side bent position. So again, I'm going to take my hand, brace it down, reach over the top. I'm going to twist my hand till I find a good stretch that's not painful. Now I'm going to take this rib cage and I'm going to think of breathing into it and then exhale. Now, as you hold that position, you want to think of holding it for anywhere from 4 to 6 breaths, because in theory, a nice, good diaphragmatic or ribcage breath should be inhaling for 4 seconds, exhaling for at least 4 seconds afterwards. So you're performing each repetition for about 8 to 10 seconds.